I guess it started as a child, as my pursuit of medicine. I wanted to be a medical doctor, and I actually went through college and pre-med, went up, got accepted in medical school, spent a year in medical school, and after a year realized that my passion was changing, and a lot of it had to do with the influence of my father, who was a pediatric dentist. And so I entered dental school in 1986 and decided I was going to become an orthodontist, and that's really where it started, childhood and through my dad's influences, and here I am today. I love working. I love coming to work every day. I love coming to see my staff. I enjoy seeing my patients and interacting with them. There's the passion to take somebody's teeth that are misaligned and their self-esteem is low and straighten their smile and just have the ability to do that with great people around me and having great patients that appreciate what I do for them. I mean, that's what drives me to work every day. I see patients that come in, surgical patients that have very low self-esteem, that are not smiling, are very introverted. And as they're beginning to go through treatment and their smiles and their teeth are starting to align, and there's just a change in personality, the way that they talk to you, the way that they greet you. I always ask patients, how are you doing? And they always, it's funny, in the beginning they're very shy and kind of hold back, but as we begin to go through treatment, they have some confidence in what I'm doing for them, and they start to see the changes. It's like, how are you doing, Dr. Awbrey? And it begins I see a complete change with them. And it's their self-esteem that's improving as their smile is improving. And then, my gosh, the day the braces come off, I mean, you see these kids light up and it's like, boom, I'm coming back to do this again. Technology in orthodontics is changing at light speed. And I'm continually educating myself to improve and learn more about the technology. I want to offer my patients the best there is out there. But all the great technology in the world is nothing without a great staff. And we hear time and time again from our patients that we know we're going to get good results here, but the thing we like the most is coming here because we got a staff. It's experience, and they love us, and that's what we hear for our patients. And so the technology is extremely important, but you need great people around you to deliver it. My orthodontist, Dr. Ron Lorber, died in a helicopter crash. I remember every single time I visited him. And I want to do the same for my patients. I want them to remember Dr. Awbrey, that I was fun and that I cared about them. And that's how Dr. Lorber was for me. So in honor of him, I want to do the same for my patients. I'm nothing without my staff. I rely on them for everything. They are well trained. They care about patients. It would be, for every orthodontist, it'd be impossible to run a practice without a staff, but a staff who cares, and they care about me. They really, truly care about me. And that's why I come, and I love being around them every day. I have set the experience here, and my staff has set the experience here because we go places and see what we don't experience. It's friendly. It's caring, it's warm. I think people, when they come here, they know that we care. It's not just something we have in our mission statement. I mean, people get the feeling, they know it. We see it when they walk out, the thank yous they give us. It's everything from the time they walk in this door and they're greeted by a front staff to the time they sit in a nice massage chair to getting an awesome cup of coffee, but knowing that their child is in good hands because of great staff and a doctor who cares. And that's what we're about here. is about a patient experience, and that's what we want to deliver. I want my patients I'm sorry.
It's from the heart.
I want them to remember me and my staff.